With the start of the May Day long holiday, the COVID-19 epidemic is heating up again in China. The Chinese Communist Party, or CCP, has made the COVID-19 epidemic disappear from the media. But a large number of sudden and strange deaths in people of all ages has revealed the truth about the epidemic to the public. Around the time of the May Day holiday, the epidemic has heated up again in China. Not only has the number of patients in various regions greatly increased, but also there are many cases involving young people, as well as many who are otherwise healthy people. They suddenly drop dead. It's a shocking situation. Many Chinese have mentioned similar cases unanimously when being interviewed on the phone. For example, in late April, Mr. Zhang from Changsha, Hunan province, said over the phone, "The number of infections has recently been particularly high, especially this month. It's too much, such as fevers, coughs, or dizziness. There are a lot of people. It'll last at least 15 days, just like the COVID-19 symptoms before. The sore throat feels like it was cut by razor blades, and it hurts badly." Mr. Zhang said that there is cross-infection in hospitals. All fever clinics are full. Many people go to the hospital, but the more time they spend there, the worse it gets. The number of local people who died of sudden diseases such as myocardial infarction and cerebral infarction, and the number of people who dropped dead on the street also increased significantly. We have many cases like that. For example, people riding scooters on the road or just walking alone on the street would somehow have sudden body convulsions. In other words, many people collapse on the street. It's very odd. Their limbs would keep on twitching, non-stop convulsions. They are people of different ages. A lot are young people, and some are teens. They would be running in the school, and then suddenly they collapse and have convulsions. Mr. Zhang saw with his own eyes that several people collapsed and died suddenly, but no one came forward to give first aid. Mr. Liu from Suzhou, Jiangsu province, said that many people in the area suffer from fever and cold, with more cases among children. Hospitals are packed, even along the aisles, extra beds are added. People are dying every day. Anyway, there are all kinds of illnesses. Now, they say it's caused by the injection. Of course, the hospitals won't admit it. If they do, it means the government has admitted it. Mr. Liu said that many infected people with serious conditions requested a test. The doctor would do the test but wouldn't tell them the results or the diseases they had. Mr. Wang from Baoding, Hebei province, said that many local people suffer from various strange diseases, and many people die suddenly for unknown reasons. My friend's company has 5 or 6 people who have passed away already. They were all young adults in their 40s. They had myocardial infarction, which had little or no time to save them. By the time the doctors arrived, they were gone. It must be the injections. They had been injected 3 times. They had to in order to keep their jobs. People died just like that, very quickly. In China, while the CCP has made the epidemic disappear from the media, the epidemic has actually never stopped in reality. Hospitals are packed practically every day, and there are many cases of people dropping dead regularly. Mr. Ding from Luoyang, Henan province, said over the phone, "The hospital is crowded. People are everywhere. Over the past few days, several people in their 40s and 50s have died of myocardial infarction and cerebral infarction. They died very quickly. Those brought in by the ambulance were dead already when arriving at the hospital. They were healthy before. They were normal, working people. The sudden death is probably related to the injections." My brother-in-law, 50 years old, had a brain hemorrhage 2 days ago. It happened suddenly. He was in good health, and there were a lot of these cases around me. Some have coughed for a long time, so they go for checks. It turns out that their lungs have small nodules. I have many cases around me, middle-aged cases, and a lot of them have died of lung cancer. People in many places have reported that the CCP authorities have made it compulsory in disguise for people to take domestic injections of substandard quality, which not only have no preventative effect but also have all kinds of side effects. People who have taken the injections, many of whom have caught colds and fever, produced lung nodules, and increased symptoms of myocardial infarction and cerebral infarction. There are a lot of them. They regret having taken the shot. Mr. Lin in Shenzhen, Guangdong Province said his father's health has been very good, but he has got a rare lupus and nephritis complication. He was treated for more than a year and spent a lot of money. It's an autoimmune disease, and they suspect that it's caused by injections. After the injection, the immune system is weak and you get nodules. It's basically common throughout China. After the shot, I became anemic and fainted. My father has lupus and heart failure. When I accompanied my father when he was hospitalized, the patient next to him was there for a blood transfusion, and he took 2 injections prior as well. There are a few seniors who got 3 different kinds of cancers in a few months and then passed away. It's just a matter of luck to live here. Mr. Zhu from Hebei said that one of his relatives, who wasn't even 40 years old yet and was in good health, died suddenly shortly after the injection. My niece-in-law passed away less than a month after the injection. It was a sudden death. There wasn't any examination after the death, and it should have been a myocardial infarction. She was at the hospital and the family wanted to take her home, but the hospital wouldn't let her go. She was running her own business. She had to take the injection or her kids would not be allowed to go to school. In 2019, when COVID-19 broke out in Wuhan, the CCP lied and claimed it was preventable and controllable and would not be transmitted from person to person, leading to the outbreak rapidly evolving into a global pandemic. But the CCP kept shrugging it off, saying the outbreak came from the US. Even today, many Chinese people still believe this claim of the CCP. Since the outbreak of the epidemic, the CCP pursued the extremely inhumane zero-COVID policy with an iron fist, and then lifted the restrictive measures abruptly and without warning at the end of 2022, leading to a major outbreak in the country. The hospital morgues and funeral parlors were over capacity. The CCP's so-called victory in China's fight against the epidemic is an outright lie. So the CCP has been hiding data related to the outbreak. It has even ordered hospitals to stop doing nucleic acid tests and treat COVID-19 as a cold, leading to cross-infections in many unsuspecting people and inexplicable mass deaths of the population. Dr. Liu, the chief physician of a mainland hospital, said the number of patients admitted to his hospital had increased sharply, and there were basically patients with COVID-19 and sequelae. Some were found yesterday and gone the next day. The hospital carried the deceased out in the middle of the night and did not dare to carry them out during the day. Dr. Liu said that the hospital had held several special meetings. The director asked the doctors not to admit that the patient was infected with COVID-19. Whoever admits it will be responsible. This is a nationwide operation. No data can be kept. Mr. Chen from Changsha, Hunan Province disclosed that his friend was a supervisor at the local hospital. He told me himself the government has asked all health departments in the country to destroy all information related to COVID-19, including information and data on the whole process of the fight against the epidemic. All data should be destroyed, not a single bit of it should remain. All computer data should be deleted. He said that this is a nationwide operation and it's real. The CCP demanded that all data must not be kept, not in paper form, not in computer form. Records of injections must be deleted. Records of nucleic acid tests and things that made a fool of the government during the whole process of the fight against the epidemic must all be destroyed. He said that the authorities are trying to erase this part of history so that future generations would not know that this happened because it was the government's failure in the first place. It's like Mao Zedong brought about the deaths of so many Chinese people, but this part of history isn't allowed to exist. According to China's CDC's official website, the number of new deaths on the mainland in February 2024 was 7 times higher than in January, with 358 new severe cases and 22 deaths. The real number of deaths can only be higher. Just now, at the end of April, the CDC suddenly issued a rare notice saying that the new coronavirus is still mutating and that the risk of spreading the outbreak may increase due to the increased number of people traveling during the May-long holiday. Li Yuanhua, a historian who is visiting Australia, commented that this is because the local outbreak is so bad that it can't be covered up anymore. They are scared. The notice said that the Chinese government wants to carry out inbound nucleic acid tests on people coming from abroad. Obviously, the CCP is preparing for a new wave of outbreaks and wants to argue that this wave of outbreaks is brought in from overseas again. Coincidentally, just 8 days after the release of the CDC notice, the National Health Commission followed suit by issuing a circular calling for a continuous increase in the number of ICU beds over the next few years. The reasons behind such a policy have invited people's speculation. Another example is the Haidian district of Beijing. It arranged for people to get injections during the May Day holiday. Beijing has begun another round of mandatory injections, otherwise you won't get your pension. A source on the overseas social media platform X said that some healthcare workers in Beijing didn't take a break during the Qingming festival or the May holiday, and that a new round of injections has begun and you can't get your pension if you don't take them. Comments read, "It seems to be mainly for the elderly. Is this intended to clear the household pension deficit?" Mainland social media platforms also have messages confirming the news that Beijing's Haidian district arranged for shots during the May holiday. One netizen said, "I came across a notice from Beijing Haidian district and thought it was a spoof, but it turned out to be true." Netizens have left comments saying, "Take the shot, receive a year's pension, and then go see Marx. You'll get nothing if you don't take the shot." Solve the problem of pension shortage by wiping out all the old people. Save the pension money if they all take the shot. And the CCP's playing with words. Without taking the shot, one can't get a pension. Who takes whose pension? This is wicked to the core. Even so, on May 8th, Li Bin, Deputy Director of the National Health Commission, was still saying that the overall epidemic during the May Day period was stable, and the positive trend of the national epidemic was further consolidated. It simply makes people doubt whether they have heard it wrong. In a democratic country, when hospitals are busy and people's lives are under serious threat, all government departments and related organizations would join forces to monitor and manage the epidemic and protect people's lives and property. But in the land under the CCP rule, the government is constantly lying to the people and hiding the truth about the epidemic. Moreover, it has been arresting health officials from the local level to the national level, with some disappearing, some being investigated or expelled, and so on. In the Committee Leaders section of the official website of the Health and Wellness Commission, updated information shows a leadership change. Lei Haichao, the former Deputy Director of the Health and Wellness Commission and Deputy Party Secretary, has replaced Ma Xiaowei as the Party Secretary. Ma Xiaowei, the former party secretary of the Health and Wellness Commission, hasn't been in public events for long. In the CCP's officialdom culture, this suggests that something bad has happened to the official. On August 22, 2023, Gao Yu, a veteran Beijing-based media professional, posted an article on the X platform saying, "Forward, the boss of the national health system, Mao Xiaowei, was taken away from the high-ranking ward of the Peking Union Medical College Hospital on August 17th. Since 2023, the CCP has made a nationwide crackdown on the health system, arresting a large number of administrative officials as well as hospital directors and secretaries, mostly because of corruption. The CCP isn't afraid of corrupt officials, it is afraid of officials who aren't corrupt. During the years of the epidemic, health officials have used their power to pocket a lot of money. The CCP has always claimed that the epidemic is under control, but now the epidemic is in such a terrible state that it's impossible to cover up anymore. Incompetent and furious, all the CCP can do is to arrest some corrupted officials. What has happened since the outbreak of the epidemic has allowed many Chinese to see through the CCP's propaganda and recognize its gangster nature. As Mr. Liu from Hefei, Anhui Province said, "Doctors won't tell you what virus you are infected with, and they don't mention the name of COVID-19. COVID-19 virus should have been around for a long time. After more than 3 years of the epidemic, the people aren't stupid. They know what's going on in their hearts now." Thank you for watching China Insights. We'll see you next time.